Processing comes better. I would say processing, I think it's just, you need to understand it. So I got the plays.
Good morning, remote attendees. Doing a sound check. Brian Alston, can you hear me? Excellent, thank you. I'll give you a copy. I do expect it now. Give me one.
Okay, good morning, and welcome to the Cook County Health Board meeting of Friday, August 28th. Excuse me, at around 9:07. Off to a little bit of a late start. So I didn't want to break up the vibrancy of the energy because it's great. We have a photographer here. Hopefully, everyone put on their best face today. At this point, I'm Raul Garza. I have the honor of serving as the chair of the Cook County Health Board. So welcome. So I have called the meeting to order, and I'm going to ask the secretary, Debbie Santana, to call the roll of the attendance, please.
Director Bott?
Present.
Director Harrington?
Present.
Director Kim?
Present.
Vice Chair Lowry?
Present.
Director Masuda Barnett? Present. Director Ryder? Is absent. Director Robinson?
Present.
Director Sorrell? Is absent. Director Stain?
Present.
And Chair Garza.
Present.
You have a quorum.
Thank you, Madam Secretary. The next regular meeting of the Cook County Health Board will be Friday, September 25th at 9 a.m. I would like to ask for a motion to allow Director Staines to remotely participate in this meeting as a voting board member. Can I have a motion, please?
So moved, Chair.
Thank you, Vice Chair. We have a first and a second. Is there any discussion or questions? All right, hearing none. All those in favor say aye.
Aye.
Aye. All those opposed, say nay. Okay, that motion carries. Why don't we go to the best part of the agenda, always, and that's employee recognition, which will be presented by Dr. Eric Makaitis, the Chief Executive Officer of the Cook County Health System.
Thank you, Chair Garza. Good morning, directors, and I agree, also my favorite part. So we're going to start by recognizing some of our new hires. Brandy Compton, Business Manager 3, Jill Johns, Director of Care Coordination and Complex Care Management, Giselle Martinez, Phlebotomy Supervisor, and Karen Jackson, House Administrator. And congratulations to Jad Ayesh for earning a promotion to Nursing Clinical Staffing Manager. Welcome and congratulations to all. We will switch now to recognitions, and as always, if you're in the room, please stand so we can recognize you when we talk about your wonderful achievements. Cook County Health is proud to announce that John A. Stroger Jr. Hospital has been recognized by U.S. News and World Report as a high-performing organization for chronic obstructive pulmonary disease, heart failure, kidney failure, and leukemia, lymphoma, and myeloma. Congratulations to all of the CCH team members whose contributions were essential to these recognitions and your shared commitment to providing exceptional care. Thank you all. Very excited to show. Oh, there we go. Thank you. Very excited to share that Cook County Health, including our Department of Public Health and County Care, were recognized with 27 achievement awards from NACO, the National Association of Counties, for its outstanding programs and initiatives that serve residents across Cook County. As an aside, this is the highest number of awards that our teams have ever achieved. Congratulations to everyone who's been here. We want to recognize 2 months worth of our Good Catch Award winners. For June 2026, Marquita Durr and Jillian Corte with Pediatric Nursing, and in July, Cynthia Claudio, Patient Transporter. Congratulations and thank you. Congratulations to Andy Wheeler, Director of Trauma Recovery and Injury Prevention, or TRIP program, on his appointment to the Chicago Council on Mental Health Equity. The CCMHE is Chicago's principal advisory body on mental and behavioral health, co-chaired by the Mayor's Office and the Chicago Department of Public Health. It brings together city agencies, behavioral health stakeholders, elected officials, and individuals with lived experience. Congratulations, Andy. And congratulations to Dr. Pamela Vergara Rodriguez for receiving this year's Ann Hilton Fisher Advocate Award from Legal Counsel for Health Justice. The award honors extraordinary advocates whose leadership and partnership have helped remove barriers to healthcare, education, and economic opportunity for adults and children with disabilities or complex medical conditions. Congratulations, Dr. Vergara Rodriguez. And congratulations to the team who helped expand Cook County Health's Food as Medicine initiative and bring this campaign to life. From January 1st to July 31st of 2026, the campaign generated 6.3 million impressions, 2.4 million video views, and 27,816 microsite visits, exceeding paid media goals. These results highlight the campaign's success in connecting community members to the CCH Food as Medicine program, which partners with various CCH teams to deliver valuable food and wellness resources while advancing Cook County Health's commitment to health equity. Congratulations, team. And on August 5th, representatives of the Committed Knitters dropped off nearly 200 baby blankets and other hand-knitted items to be given to babies born at Cook County Health's John H. Stroger Hospital. The Committed Knitters donated the items in celebration of Stroger Hospital's new doula program. The group was welcomed by President Preckwinkle, Commissioner Lowry, and several CCH leaders. Funding for materials was generously provided by the Health Foundation of Cook County. And congratulations to our CCH HIV Integrated Programs team for an outstanding showing at the Chicago Black Women's Expo. The team conducted 177 HIV tests over 3 days while engaging hundreds of community members in conversations about HIV prevention, PrEP, HIV care, county care, and Cook County Health Services. Thank you to Dr. Kendra Alder and Anita Isama, who also participated. And on August 8th, thousands of people attended the Bud Billiken Parade to celebrate the start of back-to-school season. And our team was proud to provide medical support along the parade route. And whether you were on a float or assisting at the medical tent, thank you for participating and showing that CCH spirit. Through a series of Facebook Live events, County Care is educating members on health conditions, Medicaid eligibility updates, work requirements, and redetermination, helping eligible members maintain coverage. Collectively, these events have generated more than 80,000 impressions and 1,200 clicks. Congratulations and thank you to everyone. I think that concludes the first section of the update.
That's amazing work, and I just want to add that, you know, the U.S. News recognition for treating chronic illness is no small thing. Neither are the 27 awards of excellence that the Cook County Health System was recognized on a national level. And then you add in the 1,000 other things that we're doing to touch lives, really, and that's not an understatement, and nor should it be understated, especially when we talk about the Medicaid eligibility updates that will affect at least 400 to 500,000 people in the next 4 months. It shows you that the county is not stopping its commitment to serving people. And for that, I think the board, I'll speak on behalf of the board as the chair, we are thankful for you and just appreciate everything that you're doing as though it's business as usual, but we know it's not, because you're still trying to impact lives and support those lives, but doing it in a world-class way as recognized by other outside independent sources. So for that, I'd ask that we congratulate them once again, the staff.
Yeah. Let's Vice Chair Lowry. Thank you, Chair Philippe. I just want to acknowledge County Care. I had a in-district town hall meeting on August 4th, and we discussed, County Care discussed the looming changes with both Medicaid and SNAP resources. And then we had redetermination opportunities right there on premises. It was just a wonderful, wonderful afternoon, and it was made wonderful because of the good and impactful work of County Care. So thank you.
Vice Chair Lowry, yes. I'll have more to say in my chair report that'll come in a few minutes. But before we do that, I'm going to ask the secretary, and we're on agenda item number 3. Are there any speakers registered to provide virtual or in-person testimony, or have they sent written testimony to be included into the record?
We did not receive any registrations nor any written testimony.
Okay, thank you. So now we'll go to my report. I asked the secretary to move it up because this is a big meeting for us. Obviously, not unlike any other meeting, we have a full agenda. But I think especially what's different about this meeting are several noteworthy topics to consider as we move through the agenda. First, the board will vote on the Cook County Health's proposed FY 2027 budget, where we are asked to approve the Finance Committee minutes. I think we've had a lot of conversation, especially in the last, not just the last several months, but really, I would say the last 18 months, because we had a sense that there would be dramatic change, and that change is upon us now. I think what you'll find is that the budget reflects a tremendous amount of work on multiple levels. So starting with Dr. Makaitis and his leadership within the health system, the staff that support the work, that do the work 24 hours 7 throughout the county, and certainly this board's commitment to navigate an increasingly challenging operating environment while continuing to protect. I think that's the key, is to protect access to care. We know that the ecosystem, the healthcare ecosystem, will be significantly radicalized in the next 4 months, and we know that the county will feel or absorb a lot of that the results of that radicalization. Over the past month, to be specific, the board has conducted a thorough review of the proposed budget, including 2 public hearings. I think that's important to make sure we have input from the community, from the public, that is directly affected by changes, but also relies on the county's health system to support them. So obviously these changes will put additional pressure on the Cook County health system, and really, as I stated, on the broader healthcare system. None of these decisions are easy, and they are particularly crucial as we prepare for the major changes in Medicaid eligibility beginning in 4 months and a few days. These changes will, as I said, continue to put pressure on Dr. Makaitis, but as I've gotten to know him, I don't know that he buckles under pressure in any situation that I've seen him function in. This year's budget also is predicated on an increase in the county tax allocation to help offset the significant increase we project in charity care for patients who are uninsured. And for those that don't know, and I know the staff know this really well, that the county serves over 50% of the uninsured population at our Cook County health system that exist in the entire county systems. So as a result of that, let me just say first that I'm grateful to President Preckwinkle, the Cook County Board of Commissioners, who are represented here by Vice Chair Lowry, who also serves as a Cook County Commissioner, for his and their longstanding support to the health system. And I am hopeful that this increase will be included in the county's final budget when that is approved. As a board, it is our responsibility to make sure that Cook County Health is strong, also efficient and well-positioned as possible to meet the challenges while continuing to uphold the mission of providing care to everyone, regardless of their ability to pay. So the point is that even though we're going to see these radical changes happening, the commitment that Dr. Makaitis and the leadership who are to my left and in the seats are to make it seem and to have it feel as though there hasn't been a change, because we're still going to provide high quality care in the most efficient way possible. The proposed 2027 budget will meet this strategic imperative. I'm confident of that. And as the board, we want to acknowledge that we are continuing to make important changes at Provident Hospital to better meet the patient demand and expand access to care and position the hospital for a more sustainable future and for a more sustainable focus. This is especially important as federal funding reductions threaten the stability of the broader healthcare safety net system across our region. And it's a large region. The changes at Provident are focused on areas where we know there is significant patient need. So none of this is done because it's a instinctive or intuitional decision. There's a lot of science and research that went into designing what we believe the future will be for Provident Hospital. First and foremost, it'll really take into consideration the significant patient need that exists today and the demand that exists today, including cardiac rehabilitation, behavioral health intake and assessment, expanded ambulatory, surgical, and procedural services, and increased primary and specialty care capacity. It's much more focused, much more zoned in on what we're hearing from the community and what the community's needs are. As these changes are implemented over the next several years, we expect to increase patient visits at Provident by approximately 40%. It's pretty substantial. That's a significant expansion of access for residents right here on the south side, or south of here, rather. I think the board will agree that we all know, in order to expand outpatient care and better align Providence resources with how patients are using the hospital, intensive care unit services will be paused, and the clinical triage and stabilization unit will be sunset later this month. The underutilization of these services has been a topic of discussion in these board meetings, not just recently, but for several years. There have been many discussions, and these decisions are, as I said earlier in my comments, not being made lightly. Again, keep in mind that they're part of a broader Southside strategy to ensure Provident resources are focused where they can serve the greatest number of patients and address the community's greatest health needs, which I think the greater health system in this country should really take a page out of what we're trying to do on a local level, because you have a lot of health care that doesn't get to people where they need it. And then you have an abundance of health care that's not necessary because the need's not there, because you have competition in the wrong places at the wrong time. I think this reflects the first step as we prepare for more investments to strengthen those services at Provident. Today, the board will be considering a request for the health system to execute a multi-year contract with an electronic health record systems vendor. This is the culmination of a robust process by a multidisciplinary review committee, so not one individual, and which is a very important tool that will serve as a foundation for the health system's key functions, including the delivery and the coordination of care, scheduling, revenue cycle, and really critically important to all this work is data management and more, so we can learn more about the people we're taking care of. The work we are doing on the budget, the evolution at Provident, the procurement of our EMR platform demonstrates something important. Cook County Health is not standing still. The work will move forward at a time when it has to, especially with these changes that are coming. We are making mission critical decisions today with an eye to the future, improving our operations, expanding access, and investing on the south side, improving our ability to serve patients, and positioning the health system to withstand what we know will be significant challenges ahead. And I think we should embrace that, because we have no choice but to really embrace that. Finally, I want to thank my fellow board members for their time, their expertise, their thoughtful consideration, their hard-hitting questions. You've contributed as we approach these milestones, and you've helped position the Cook County Health System where it sits today. I also want to thank Dr. Makaitis and the leadership team, which is really an understatement to say that their hard work that they do every day to position the health system has been successful. And of course, I want to thank the staff who are on the front lines, whether in the community, meeting the patients where they're at, they're in clinics, they're out at fairs, they're on parades. We had such a large and significant presence just a few weeks ago at the Bud Billiken Day Parade, which I think is really synonymous with the county's mission, and really taking care of those young people that are in schools. I want to also thank also the people in this room that provide the support, like Sam over here, will make sure that, I think you can hear me, Sam, because your earphones on, but Sam, yeah, Sam make sure that my voice projects, because I'm a soft-spoken guy. but then also our secretary, Debbie, who keeps us organized in a lot of different. So, in winding down, the work before us is difficult, but make no mistake, it is essential. And together, we are fortifying Cook County Health for the future, which is upon us immediately, and ensuring that our fundamental mission remains strong, and that is to provide high quality, accessible health care to all, regardless of their ability to pay. Now, I want to shift. This is really, in a lot of ways, a sad moment, but it really is a moment of celebration and recognition. And I want to take a moment to recognize two people that one individual I knew for sure before he joined the board, and then the other individual I got to know, like we all did, because of his hard-hitting questions. That's a tribute to you, Sam. And I want to recognize Dr. Jay Bott and Sam Robinson. And I want to take a moment to recognize these two board members, because their terms will come to an end in September. Both plan on joining our September meeting, but I didn't want to miss the opportunity to acknowledge them while they're all here in person. And since we have such a nice crowd, wanted to make sure they were able to participate in the recognition. So Dr. Bott and Director Robinson joined the board of Cook County Health in October of 2022, nearly 4 years ago. And it was at a time when we were coming out of COVID, and COVID was still lingering in so many ways. And over their past 4 years, they have each brought a depth of expertise, perspective, and commitment like I've never seen, that has strengthened our work and ultimately strengthened the Cook County Health system. Dr. Bott has served as the chair of the Quality and Patient Safety Committee since 2023, so nearly 3 years. He has brought an important focus to our work, making sure that quality and safety are not simply measures we report, but principles that guide how we operate and how we care for our patients. And I couldn't think of a better person to have chaired that committee, given what I know about Jay's background and his life's work, and really caring about quality and patient safety. He has consistently asked thoughtful questions. In particular, he's challenged us to look at our performance honestly and help keep the patient always at the center of our discussions. His experience in healthcare leadership and quality improvement has been certainly an important asset to this board. So Jay, thank you for that. I'll give you a minute, in a minute. Director Robinson, my friend Sam, he's provided exemplary leadership as part of our Finance and Human Resources Committee, helping us to navigate some of the most consequential operational and financial decisions facing Cook County Health. I think you've asked the most questions of any board member. And I say that with nothing but admiration and respect, because it shows how much you care about what's happening at the Cook County Health system and within the board. You brought a rigor, and that's an understatement, a thoughtful analysis, and a willingness to dig into details, whether we are talking about budgets, workforce, organizational performance, or the long-term sustainability of our health system. And for the staff, just know when you've had the opportunity to sit at that table behind those two chairs, and you've come before the board and you've had to answer questions from Sam Robinson, it's because he cared and he was digging deep into the information to make sure he understood it and to make sure that the right decisions were being made. Over the course of both of their terms, both directors have been part of really a significant moment for this organization, participating in 4 budget cycles, the hiring of Dr. Eric Makaitis as our permanent CEO, and providing input and guidance as we've developed and implemented 2 strategic plans. While 4 years can sound like a relatively short period of time. I liken one day in Cook County to a month in some other places and other lives, really, because of everything that's going on. And for me as a chair, it's like a couple hours. So Dr. Bott and Director Robinson have been here through all that tremendous amount of change, and they have helped provide the governance, the accountability, and the perspective needed to move this health system forward in a way that I don't really believe is happening anywhere else in the Chicago metro area. And of course, that's my own editorial, but I really believe that. On behalf of the entire board, I want to thank both of you for your service, your partnership, and your commitment to Cook County Health. To say that we are grateful is probably not saying enough, but we are grateful for your time and your expertise that you've given to the organization, and most importantly, to the people in the community of Cook County. Thank you. So, gentlemen, I'm going to ask you to come up. With our tradition, we have a gift for you. So, Sam, come up first. Not many people get these. So. Dr. J. Bott. Okay, before I ask Sam and Jay if they want to give any comments, I want to open it up to the board, see if there are anything you would like to share. Please, Vice Chair Lowry.
Thank you, Chair. Knowing that we'll have another shot in September, I'll be really ready then. But let me just say, I'm the converse of you, Chair. I've known Sam for a long time, and I've had the pleasure of getting to know Jay over the last several years since I joined this board. But both of you represent several things that speak to the whole mission of Cook County and Cook County Health. And that is, first of all, you're passionate about healthcare. You get and embrace that healthcare is a right shared by us all, as opposed to a privilege reserved for the few. And where better than here for us to live out that messaging, right? And you two have led us with that. Sam, your questions are not only so that you have clarity, but so that we have clarity. And we appreciate you peeling the onion the way you always have. Jay, I want to acknowledge you and thank you for making sure that we're always in the space of good governance. And you two will both be missed as board members, but not as friends, because I got both cell numbers.
Thank you, Vice Chair Lowry. Anyone else?
Yeah, I want to pick up where Director Lowry left and thank both of you. I knew Jay before he came here because our paths crossed several times. I've always known him not only to be astute in terms of his knowledge of medicine, but also compassionate. So that's a quality I think a lot of us bring to this table, compassion for other people and concern and care for other people. In terms of Sam, Sam was the one that always asked the tough questions, and sometimes the questions that other people wanted to ask but were afraid to ask. So I value your service on this board as well.
Thank you.
I just want to add, I didn't know about Dr. Bott, but I actually saw his photo of him getting an award or something in our Department of Health Policy. So I learned that he was our student before, and then I learned so much from Dr. Bott. being on the quality committee together. So thank you. And Dr. Robinson and Dr. Bott have been very, very supportive when I joined last year. Learned so much. So thank you so much.
Thank you, Director Kim. Anyone else? Yes,
Just thank
Bob.
both of you for your robust participation in all of our meetings and adding to the discussion, and look forward to seeing how you all, Dr. Bott and Dr. Robinson, how you contribute to helping us keep our community strong.
Thank you. Okay, I'm going to turn it over to Sam first, and then Jay. Sam, anything you want to say?
I didn't prepare anything. I didn't know we were doing this today. But I will say, I've enjoyed being on the board, being able to provide good care, actually great care, because I think Stroger and Providence have the potential to do more than they've done. And I think the people of Chicago and the greater Chicago area are better for it. My questions have always been to be able to get to the best answer. My philosophy is no one's the smartest person in the room, but if we collectively address the question, we can get to the best answer. So that's where all of my questioning has come from, will continue to come from, it from that perspective of trying to get to the best answer. Because if we're going to sit in the seat of guiding and providing health care, we owe it to the public to do such. And that's always been my desire. So thank you for the opportunity.
Thank you, Sam. Dr. Bob.
Thank you, Mr. Chair. I'm so grateful. It's an honor of a lifetime to serve on this board because of how much it means to the people we serve and the community we serve, and a beacon of hope, possibility, impact, and opportunity for this country. And I just want to thank President Preckwinkle, County Board of Commissioners, for this incredible opportunity to serve, and just want to thank the two chairs I've served under for their leadership, and our board, because you've made me not only a better professional, better board member, but a better human as a result of being in fellowship and community with you, where we all play for each other. We want the best health for our residents and be an example for many others around this nation. And I think we've made enormous progress in that pursuit. I know the team here does incredible work. They work hard. They care so much. And that's inspiring for me. And we're unique in the way that the system's integrated with public health, jail, ambulatory, and our acute and inpatient facilities. And I think it's an enormous opportunity to show what's possible when those come together towards improving the health of our people and community. And I'm just so proud of the work that this health system has done in the last 4 years, and proud of the legacy it's built on, and just so proud of this board for the conversations and discussion, and just so grateful for the team and Dr. Makaitis, your leadership, and Debbie and Sam, thank you for all that you do to make this work. And I'm just grateful to have served with tremendous board members. And thank you for all your support. And I'm be a friend and collaborator with Cook County Health for many years to come. So know that you can reach out, and I'll be cheering you on and being a part of it. And the other thing that's been really great, I've been grateful for, is to getting to know the physician and clinical community at Cook County Health, who are on the front lines working hard every day to deliver outstanding care and keep people front and center, high quality, safe, equitable care. And I'm so proud of that. So thank you again for this opportunity.
Thank you both. Okay, one last thing, I'd ask that you stick around to the end of the meeting. So not that you would leave, but we don't want to mess up the forum or the quorum. So okay, let's go on to item 4, board and committee reports. So item 4A, minutes of the July 31st, 2026 board meeting. I'll present those. I will ask if there are any questions or any comments about those minutes. No, then I will ask for,
Motion to accept the minutes.
thank you, Director Ryder.
Seconded.
Thank you for the second. Is there any discussion? All those in favor say aye.
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 Thank you. Or nay? Thank you. That motion passes. We'll move on to item 4B, minutes of the August 20th, 2026 Human Resources Committee meeting, which Director Harrington will step in, Director Sorrell-Stead to review those. Director Harrington.
Thank you.
Wow.
The Human Resource Committee met on Thursday, August 20th at 11:30 a.m. The committee's next regular meeting is scheduled to be held on Thursday, November 5th at 11:30 a.m. The committee received the report from the Chief Human Resource Officer. It's included in the minutes, and it included the following subject areas: mid-year impact summary, demographics for all CCH employees, current state of hiring and separation, CCH executive dashboard, and the fiscal year 2026 nursing hiring metrics. Also included talent acquisition, that included fiscal year 26 hiring events, recruitment highlights, and focus areas. Additionally, workforce development engagement metrics were highlighted, including the fiscal year 26 Cook County health turnover, efforts to reduce employee turnover rate, life cycle services surveys launching 9/1/2026, Cook County Health ACHNs and CPS externship program, the Applied Data Fellowship Program, Cook County Health Healthcare Career Expo, and key milestones and next steps. There was a final farewell for Don Woodfield Brown, and if there are no questions, the minutes are being presented for consideration at this time.
Thank you, Director Harrington. I'd like to ask for a motion to approve item 4B, the minutes of the meeting of the Human Resources Committee of August 20th, 2026. Can I have a motion, please?
So moved.
Second. Sure. We have a first and second. Is there any discussion? Any comments? Hearing none. All those in favor say aye.
Aye.
All those opposed? All those opposed, nay. That motion carries. Thank you. We will now move on to item 4C, the minutes of the August 21st, 2026 Quality and Patient Safety Committee meeting. And I will ask Director Bod, who serves as the chair, to present that report, please.
Thank you, Mr. Chair. The Quality and Patient Safety Committee met on Friday, August 21st at 9 a.m. The next meeting of the committee will be held Monday, September 14th at 8 a.m. Note, the meeting date changed from September 18th. The committee approved the following action items, which are included in the minutes. Approved 2 Stroger Hospital Department Chair and 5 Division Chair reappointments. Approved Stroger and Provident Hospital medical staff appointments, reappointments, and changes as amended. The committee also received the following reports, which are included in the minutes. Grievance and patient experience report, experience and performance improvement updates from Stroger Hospital, Provident Hospital, ACHN, CIRMAC, CCDPH, and County Care. Also received performance improvement updates on Medicare annual wellness visits and fall prevention. And just want to appreciate the hard work of our teams and the comments from our committee members. And if there are no other questions on the minutes, they're being presented for the board's consideration at this time.
Thank you, Director Bott. I'd like to ask for a motion to approve item 4C, the minutes of the meeting of the Quality and Patient Safety Committee on August 21st, 2026, which include approval of the following items. 2 Stroger Hospital Department Chair and 5 Division Chair reappointments, and the Stroger Hospital and Provident Medical Staff appointments, reappointments, and changes. Can I have a motion, please?
So moved.
Second.
I have a first and a second. Is there any discussion, any questions, please? Hearing none, all those in favor say aye.
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 All those opposed, nay. Okay, that motion carries. Thank you. We now move to item 4D, Finance Committee, and I'll ask my colleague, Director Ryder, to please review that with us.
Thank you, Mr. Chairman. The Finance Committee convened a special meeting on July 31st for the purpose of introducing the proposed Cook County Health fiscal year 2027 preliminary budget and conducting public hearings. The meeting was reconvened on August 10th and August 13th for public hearings. At the public hearing on August 10th, 7 members of the public provided testimony and 1 written testimony was submitted. At the public hearing on August 13th, 8 members of the public provided testimony, and one written testimony was submitted. The written testimony submitted are included in the minutes and are part of the meeting record. This meeting was held for informational purposes. There were no action items considered at the meeting. If there are no questions, those minutes are being presented for approval.
Thank you, Director Ryder. I'd like to ask for a motion to approve item 4D, the July 31st, 2026 Special Finance Committee meeting minutes. Can I have a motion, please?
So moved.
Second.
We have a first and a second. Is there any discussion or comments about that motion? All those in favor say aye.
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 All those opposed, nay. Motion carries. And then the minutes of the August 20th, 2026 Finance Committee meeting. So this would be the regular meeting. I'll turn that over again to Director Ryder.
Thank you, Mr. Chairman. The Finance Committee met on Thursday, August 20th at 10 a.m. At this meeting, 3 members of the public provided public testimony on the budget, and 1 written testimony was submitted. The committee considered the following action items, which are included in the minutes. Conditionally approved 24 contracts and procurement items. Number 2, 5, 6, 7, 11, and 16 are pending review by contract compliance. On the screen, you'll see the contractual requests from the Finance Committee meeting whose fiscal impacts are greater than $1 million, which are highlighted for your information. We received and filed grant award related items, and we approved the Cook County Health fiscal year 2027 preliminary budget. The committee received the following reports, which are also included in the minutes. The MBE WBE report, the first quarter 2026 report of contracts executed under the authority of the CEO, report of 3 emergency purchases, report of June financials, and the bi-monthly report on our agency reduction plan and monthly guidehouse recruitment update. I will note that we have now seen the budget presentation either as a board, as a Finance Committee, and also through the special meetings 1, 2, 3, 4, maybe 5 times. So I am not asking that be reviewed again, though if anyone has any questions, myself and members of the staff, I believe would be willing to answer any questions or go over any materials. I will be asking that the minutes be adopted as part of adopting the minutes. That would be adopting the fiscal 2027 budget by the board of directors.
That aligns with what I have. So that's
Sorry.
good. No, it's good.
Jumped ahead.
No, it's good to sure people hear it. So with that, I will ask for a motion to approve item 4D, the August 2026 Finance Committee meeting minutes, which contain the following action items. Conditional approval of the contracts and procurement items pending review by the contract compliance and receiving and filing of the grant award related items. And then once again, to underline, approval of the proposed Cook County Health fiscal year 2027 preliminary budget. Can I have a motion, please?
So moved.
Thank you. Is there a second? I've heard a second. Is there any discussion or questions or comments about the items within the motion? Okay, all those in favor say aye. Aye.
Aye.
All those, thank you. All those opposed, nay. That motion carries. Thank you, Director Ryder, for all the work that went into that. Tough work. We'll now move to item 5, action items, which is contracts and procurement items. We have one being presented, and I will ask Charles Jones, our Chief Procurement Officer, and Dr. Mark Spranka, the Chief Scientific Officer, and they will provide an overview of this item. Gentlemen, welcome.
Thank you. Good morning. Charles Jones, Chief Procurement Officer for Cook County Health. We have before you today one item, and that item is responsive from the Office of Contract Compliance for MWBE participation. That will turn it over to Dr.
Good morning, directors. Mark Spranka, Chief Scientific Officer. I have before you a request to increase contract Huron Consulting Group The amount is $4,856,530. This will take us through the end of the contract period of November 30th, 2027. This contract is designed to provide both strategic support and operational support to the life sciences as we continue to build and execute against our objectives.
Any questions or comments? Okay, with that, I'll ask for a motion to approve request number 1 under item 5A, the proposed contract and procurement item. Can I have a motion, please?
So moved.
Second. We have a first and a second. Is there any discussion? Any questions? Hearing none, all those in favor say aye. Aye.
Aye.
All those opposed, nay. Thank you, gentlemen. That motion carries.
Thank you.
You're welcome. Item 6 was the report from the chair. I gave that already at the start of the meeting. So we will now move to item 7 and have Dr. Makaitis, the CEO of Cook County Health, invite his colleagues to provide 3 different presentations, starting with an update on the strategic plan and the ARPA obligations being presented by Andrea Gibson, our Chief Strategy Officer.
All right, thank you, Chair Garza. We do have 3 items. We're going to start with Andrea. As Chair Garza said, strategic plan and ARPA update. We will then move to Manny Estrada and have a CIRMAC update. And lastly, we will close out this report with our employee engagement survey result review with our colleagues from Press Ganey.
Great. Good morning, everyone. Andrea Gibson, Chief Strategy Officer. So the item before you is our monthly update on some of the accomplishments for the past month. I'll highlight a few of these. Under quality, safety, and experience, I wanted to highlight that Stroger's inpatient length of stay is trending lower in 2026, with June's average at 5.11, which is the lowest since 2022. I also want to flag that an urgent care is being established at Arlington Heights, and that should be coming soon in the next few months. Under workforce, I'd like to highlight that the community health worker high school pipeline program concluded with 8 graduates. Under transformation and growth, the lab automation line went live and should improve processes in the lab going forward. Also, County Care increased market share by 0.44 percentage points, reaching 35.3% of the market. And under fiscal resilience, we've been able to work together to increase County Care utilization of surgical services. It increased by 10% compared to 2025. We can go to the next slide. So on ARPA, we're on the countdown now. As you recall, ARPA ends at the end of December. We have 34 million remaining to spend. For the subrecipient expenditures, the activity related to that has to be concluded by September 30th. And we are on track. We have had, I think this morning we had one subrecipient say they won't spend 100,000 of it. So we're working through that, but we're generally still on track with expenditures of ARPA. So I'd be happy to take any questions you may have.
Thank you.
Thanks, Andrea. We'll have Manny Estrada, Chief Operating Officer for CIRMAC, come and give us an update on CIRMAC.
Good morning, directors, and thank you again for the opportunity to present.
Good morning.
Good morning, and I thank you for the opportunity for presenting an update to CIRMAC's mental health program. I start off by telling you we've had a lot of information that we provided related to our behavioral health program. Of importance for us is as an organization, as we've matured, we've been able to identify the specific needs for our patients. Not one program fits all for the patients at Cook County Jail. So with that, I will go through some of the specific programs that we have. The first one being the Behavioral Health Management Unit. This is a unit that's specialized. It's a low census unit. It's a low capacity unit, 10 maximum census, where we look specifically at patients that have behavioral management needs. These are folks that we have that have a mental health diagnosis and or condition, but principally it's the behavior that drives the need to be in this specialized unit. It's a restrictive environment where we do provide an increase of opportunity for staff engagement. It also increases the opportunity for individual treatment as well as group treatment, but specifically calling out that this is where our custody partners have a higher level of involvement with our patients. The patients have demonstrated that their behavior leads for additional resources, primarily from our custody partners, but also additionally supported by intensive therapy from our patients. This unit in itself has been in existence for approximately a month and a half, and to date, we've been able to demonstrate some successes with this unit. For example, there were issues at the jail where we identified fires that were being started. We were able to demonstrate in that time frame that individuals, we had 6 individuals, which were causal effect to about 36 fires prior to being enrolled in this program. We were able to have that number decrease to 0. There were 0 instances of fires being started by individuals, again, because of the involvement of our custody partners, but also because of the intensive involvement of our staff. Next slide, please. The goal of the BMU is to specifically deal with the behavioral health management aspect of the patient, but also prepare the patients for being able to function in the general population type setting in the facility. This unit allows for patients, regardless of their level of care. As you may remember, we have P2 through P4 for our patients. These folks are generally P3, P2 patients, which is the largest population we have in there, and regardless of their custody level, reside within this unit. The patients that we have here have, again, demonstrated behavioral health or behavioral management issues, which would benefit from the programmatic and security level care that we provide. We have an incredible amount of care coordination that happens multidisciplinary with all of our teams involved: medical, mental health, behavioral health. Next slide, please. The other specialized unit that we have is the ABLE unit, Alternative Behavior for Life Experiences. This unit is driven principally by the therapeutic and or clinical needs of the patients. Where I referenced the BMU prior to, that was behavioral management. This is more clinically driven. It is also a low census unit that we have, capacity of 10. We currently run a census of 7. In this area, we structure it primarily to work with our patients with the therapeutic aspect of it. This includes groups, this includes individual therapy. Ultimately, we would like to transition these folks based on their outcomes from their treatment to a lower level of care and or appropriate setting within the facility. We also look at med compliance specifically in this group. One of the outcomes measures that we track is whether or not our patients are compliant. We also have demonstrated successes with this group in that the adherence and the compliance, and ultimately the outcomes for our patients have demonstrated a positive swing. This unit has been in existence for approximately 2 years. And as I described earlier, as we matured, you can see the progression of the development of these units. Next slide, please. The original specialized treatment unit is the therapeutic tier in Division 9. Division 9 is our maximum security division at the facility. Patients are housed based on their level of care and their security level. Division 9 is strictly maximum security with the population generally of our P2 or what we consider outpatient population. They're higher census living areas. We developed the therapeutic tier with approximately a capacity of 40. Right now, that census is at about 35. These are patients that have been selected based on their wanting to participate in this particular program. It also takes the opportunity to provide individual and group counseling for the folks that are enrolled in the program. Unique to this is that we also have peer-led groups. So we've selected from folks that we have participating in the program the ability to have that aspect that we don't provide in the other groups. The ultimate goal for the therapeutic tier in Division 9 is to prepare folks for ultimately being able to reside outside in the community, preparing them with the life skills, preparing them with the structure, preparing them with the skills. I'd be remiss if I did not call out our mental health leadership at the jail. We have had the privilege of bringing on some of our subject matter experts. Laura Hughes, who happens to be at the jail today, is our Director of Mental Health. Dr. Michael Bednars is our Chief Psychiatry. He's also at the jail doing the work that needs to be done. And finally, Pierre Nunez, who is our Chief Psychologist, who's also at the jail. They all wanted to be here, but of more importance is for them to be on board, providing leadership and direct patient care at site today. With that, I'll open it up to any questions you may have.
So Manny, thank you very much, and thank you for your good work. Thank you for always being willing to host me there at CERMAC and making sure that I get out too. I appreciate that. You know, earlier this week on Wednesday, we had a wonderful meeting, including you, of course, CCH, the sheriff, and JC. And we discussed mental health services and specifically the connectivity issue once individuals are discharged from CERMAC. Right. We also discussed strategies to accumulate data relative to recidivism. Wondering if you could just comment on both of those since we had a robust conversation just 2 days ago.
Absolutely. Thank you, Commissioner. We did, and we do have ongoing relationships and conversations with not only the sheriff, but also our community organizations. The ultimate goal for us at Cook County Jail is to prepare for our patients as they will be returning citizens. We are very different from our prison colleagues in that we are a temporary detention center. So the reality is our patients will be leaving us in relatively short order. Our average length of stay is shorter. So we expect to be able to transition as best as we can to ensure that our patients land with the resources in place. To that end, our conversation focused on ensuring that we build up the resources that we currently have now in alignment with the Office of Behavioral Health, in alignment with the Sheriff's Office, in alignment with CERMAC Health Services to provide that connectivity. Of conversation, we included the opportunity to leverage the 1115 waiver. I'll report out here that we actually met with HFS yesterday, who reaffirmed their commitment to continue with the reentry services. So that to me was a positive. We were in a holding pattern, but that communication started again. So I look forward to leveraging that. Ultimately, the component that is the most complicated for us is transitioning from while you're on the inside of the wall to when you're going back home to wherever it may be. And allocating those resources for those patients in their area of need. That's the work that remains to be done with already the structure in place. And ultimately, our goal is to leverage the resources we currently have, as well as whatever opportunities we have to make the transition. It is a lot of work. It's a heavy lift, but nonetheless, we're up to the challenge and we understand the mission and the charge.
I appreciate that. And just for context to my colleagues on the board, if you haven't, I really encourage you to take a tour, go there and visit the jail, visit with Manny and others there. And you can't do that without learning something. So one of my last visits, which really prompted the meeting we had on Wednesday, I was speaking to a young man who had been discharged and then came back. And while I listen more than I speak when I'm in those situations, I did ask him, I said, well, when you went home before, did you have a job? He says, yes. He says, you have transportation? He said, yes. I said, do you have a roof over your head? He said, yes. He said, but the reason why I ended up back was it was 4 days I did not have a continuation of my behavioral health care. And it just shows how tied all of these different facets are relative to those in our community. So again, I encourage all of us to get out there, learn, listen, and it's nothing better than actually seeing everything that's going on within our jail. Thanks.
Thank you. And please, you're welcome to come out.
Just a quick question about those low census programs. It sounded a really wonderful program, but I'm just curious, like how you actually identify, you know, under 10 people out of assuming like about 5,000.
Yes.
Do you feel like there are like people who are not?
Excellent question. Yes, that is part of the process. Folks are identified based either on a couple of different components. One is custody makes a decision with us. It's not us individually. We can say this patient needs to, custody may have information that doesn't allow for that patient to participate for whatever reason. So it's a combined decision making for all of the programs. And principally, the difference is folks that we've identified that principally have a behavioral issue. There is an underlying mental health condition, but it's a behavior that's causing the want to put them in a specific program. Those are folks that we identify for the BMU. There are patients that are, and I call them patients. DOC has the term for them, it's called individuals in custody, IICs. We use it interchangeably, but we identify patients that are high utilizers of services based on their behavior. This is an individual that caused a disruption in operations based on something they did that continuously happens. So those are the folks we identify for the BMU. Folks that we have provided services for that are more clinically inclined, that have demonstrated that there's a compliance type issue with their medication, that there's an adherence to the program that would benefit for a more intensive clinical intervention aligned with DOC, but principally clinical. Those are folks that we identify for the ABLE unit. And specifically for the therapeutic chair in Division 9, it's their location. These are all folks that have been designated as a P2 level of care, which are outpatient, but based on their security level, they can only be housed in that building, but they've demonstrated a want to be participatory in more intensive and or inclusive program. And again, those are selected through a vetting process. There is a waiting period for all three of these units where we ensure that they're appropriate for the setting, appropriate for the treatment, and appropriate from a custodial level to ensure that they're successful. Most of the folks do well. Some folks we continuously work with because things change at the jails, conditions, situations change, but the continuum is different. For us, it's that not one program fits all, and we have to be able to gear towards our special population that we have to be able to individualize that treatment. So it's a cycle, it's moving, it's living, it's breathing, and it's continuous. Tomorrow we may have a different population based on some of the happenings, but it's continuous. Hopefully that answers your question.
Sam, I'm not sure I'm not. I know it's yeah. Trevor, let me mention how we. He may help me out here. Manny, so I'm always impressed with all your presentations. Your work is complex, certainly progressive. So I'm just curious, is there any other county system nationally that puts the investment and the time and the passion into their detention system like we do? I mean, I know that a lot of this work is outsourced, and we've seen the reports from various media outlets on the quality of that work. I'm just curious, when you've done a national review, I know you're a thoughtful person that way. What does that look like on a national level from a county perspective in their detention systems?
So, you are correct. The work we do in a lot of venues is outsourced. They're contracted vendors that do the work. I formally won't tell you who, but I used to work for some of the folks on the other side. Personally speaking, and this is my personal opinion, the work we do here is not comparable to the work that's being done by the for-profits. We're there because we are there to provide. We are part of the county. We are there because it's constitutionally required. It's the right thing to do, and it's our calling. To answer your question, we have an accrediting body called the National Commission on Correctional Health. This accrediting body is the premier organization for us. There's several that are out there, but this organization focuses on correctional health with a look to also the custodial aspect of it. We're currently accredited for 2 of the 3 accreditation opportunities that we have for NCCHC. OTP, our opioid treatment program, which is folks that are on substance use disorder or opioid, methadone, Suboxone, other long-acting medications. We've been accredited since 2009, I want to say. We're accredited for jail standards. You may remember, or I'll remind you, we were in a consent agreement up until 2018. We achieved our national accreditation in 2023. So we're cycling now. We went through our accreditation process, and finally, they have a mental health accreditation that we will be submitting for in the first quarter of 2027. So we will be able to proudly say that we've achieved accreditation for all 3 that are available through the National Commission on Correctional Health. That will align us to be one of the few organizations across the country that have met that threshold. Our stated goal is to be the example by which correction health is measured across the country, and I'm happily reporting here that we're well on our way to be that. I know not only by my opinion, my opinion matters, right?
Yeah.
But also by the accrediting bodies that are out there looking at the work that we do. I will share with you, during our recent accreditation, the surveyors that came through other organizations throughout the entire country, our colleagues, again, big jails, small jails, big prisons, little prisons, told us, you're our bucket list. We want to come and see what you do here.
Have any come actually to see?
Yes.
What we're doing? Yeah.
Absolutely. I've had people from Arizona, from New Mexico, from California, locally. Folks come in here and they're in awe for what we do. What we have is a complex mini system within a system. And the services that we offer are tremendous. Yep. Again, my opinion matters, yep. But the opinion of the accrediting body and our colleagues also matters.
Yep. We're going to see you in a month or in the next month,
yes,
Manny.
You're welcome. We'll even bring pizza.
Doesn't matter. We'll bring you food.
Thank you.
Any questions or comments?
I have a question.
Yep.
Oh, go ahead. Okay. This is a question that I've asked, I think, every time you come before the board. And Commissioner Lowry actually spoke to exactly that question. And previously, we were under the understanding that there was a warm handoff. And honestly, I never believed there was, because I have heard the things that Commissioner Lowry heard as well. And so my question is, when you have a person that has mental/behavioral health issue, can a warm handoff happen with maybe Dr. Nutter or Dr. Carter, public health? Because and I understand your position, you take care of them inside the wall, but if we're really trying to solve the problem, that has to be the focus of what we do, because you've done so much hard work on the inside and you literally throw it away as soon as they come off their meds. And now the system is taxed again, the taxpayers are under pressure. So to not have that connection, we're still lacking. We're lacking tremendously. Again, it does not comment on the work that you've done, but it speaks volumes about how can we really solve the problem. So the question becomes, can we meet with public health and Dr. Nutter to find out how to get these people into good hands so that they don't come back in? Because you're not lacking for customers. You have more than enough.
Correct. The short answer is we are meeting with Dr. Nutter and we are meeting with Dr. Yoshi is here too. I saw him a few minutes ago. Dr. Yoshi and I, again, I say we're palsies. We're come from the same cloth. I am public health, believe it or not, within the jail. And Dr. Nutter and I have long, intimate talks all the time. The plan and the goal is to leverage the behavioral health umbrella for the entire system. We are a system of one, right? But we are a partner of many. The ultimate goal is to leverage all the resources that are in the community, and that's work that's undertaken now. I wish I could tell you that I have an end date. I don't. I can tell you every day we get better. Every day we offer more. We have an inpatient population of about 6,000, of which about 50% are on the mental health caseload. Of that, I can break up into the various levels. Our focus will be and continue until we are in a better place to focus in on those that have the highest level of cares, our level 4s and our level 3s. We do have some warm handoffs with some of the patients that we identify. Ultimately, the goal is, and the reentry program that we have with the 1115 actually requires that we do more than that warm handoff, that we manage that patient from beginning to end, not only in the jail, but back into the community, which is ultimately where the vast majority of our patients are going. So that's currently the status now. And the goal is, Director, exactly what you just described, do that warm handoff. More than just, this is what we have. This is the clinics that are out there. It's you have an appointment in a clinic with this provider, and you have medications to bridge you until you get into that clinic. We do that in certain aspects with certain patient populations, but our charge is to do it for all of our patients.
So I think this highlights something, you know, in the mental health field as it pertains to the work at CIRMAC is, you know, to your question, you know, they have a process to it, working with those partners. Ultimately, you have to set up a structure that people can employ, right? And, you know, our ability to help influence and provide and have an audience with the patients in the system gets looser as they have reentry. So, I mean, I think to the point of what we can do, what we do through public health helps, you know, bring awareness and, you know, talks about the mental health crisis generally as it pertains to being a public health crisis. But that, as you know, as someone who takes an anxiety pill every day but didn't for most of his life, we still have to get people there so they can make the decision to continue to engage in treatment. The challenge isn't being able to coordinate our services and make sure that we're doing all the things to create the environment. The challenge is to not give up the work to provide those services for when people are willing to, when the conditions we've created meet the condition of their acceptance and their willingness to continue their treatment and engage with their treatment. And that's tough, especially in big cities and in places that have a lot, you know, a lot of the folks that we see through CIRMAC are coming from you know, communities where there's a lot of trauma, in addition to whatever they bring to the table, you know, genetically, right? So I just want to thank you and the and public health and Dr. Nutter and everybody here who works on the issue, because it's a persistent chronic issue that you know, some of us are able to fare better because of a zip code or a social infrastructure that we already have, and you know, even with those things, sometimes the crisis pierces through. So just continue to keep your shoulder behind it. Thank you.
No, thank you. I appreciate the words.
Thank you. I think it's a good plug for what the county will be hosting in about 12 days on September 8th, which is a behavioral health summit all day. And so I think that'll be all things behavioral health and what the county's trying to do to impact in a greater way people that have the needs that Director Ryder spoke to. So please try to make it for part of that if you can't be here all day. Any other questions for Manny? Jay, I think you had one.
Yeah, thank you, Mr. Chair. Manny, thank you and the team for the hard work and also the work of the integrated system on this issue. And Commissioner Lowry, Director Robinson, Director Ryder raised some things I was going to bring. And I think about this as a continuum of prevention, treatment, and recovery. And prevention doesn't just hang at prevention, it follows through, right? Correct. Treatment and recovery. And so as you're in those moments, how does the behavioral health unit think about prevention and upstream action? So there may be, I don't know what they are, but the disproportionate drivers of recidivism and reentry, what is the upstream strategies to address that? And then what is the high-performing community-based partner network? Because who are our community-based partners in addition to the integrated system and those, other organizations we work with that have to help us? Because it can't be all on the shoulders of the health system and the jail and the health department. So I think that's something I'm curious about. But the question I'll ask is, as you think about progress and success on what you've shared with us, what are a couple of things that you want to see that demonstrate that you're making progress towards, the aspiration?
The question is, what do we see as?
There are a number of different metrics and things you're saying in terms of what you'd like to achieve. Are there a couple of things as North Stars that stand out to say, in 6, 12, in a year, what things may have happened that show that you're making progress on this strategy?
Absolutely. So one of the things that I referenced earlier is our accreditation with mental health, because that to me demonstrates that we have the gold standard. We've already met the requirements nationally for what it is that we do. I believe we're there already, but that documentation will at least affirm on a national level what we're doing. Internally to the department, the solidifying of our structure, we are probably about 80% of where we need to be. We've made some tremendous strides in getting leadership in place, building our clinical teams. We're finalizing what we call milieu worker, which is our programming, our groups. There's a small component that we need to do to effectively have the entire team together. That to me will be when I can say we've been successful in maturing as an organization, because we've developed the infrastructure from a human capital perspective. And ultimately looking at the future state of what do we do to actively affect the recidivism? Because for me, and I believe our colleagues on the jail side, what do we do to effectively decrease the number of folks that are currently cycling through the system? We've identified, our DOC colleagues have identified the core group of people that are just continuously coming in. They're being discharged, they're being admitted in an inpatient facility, but yet again, they're coming back in again. What can we do better? I'll tell you that there's some things that we've done that we can probably enhance a little bit with some assistance. We provide our patients with tools to be able to function when they're out. One tool is having resources to leverage medical services, mental health services. Having Medicaid, for example, or the opportunity to apply for Medicaid. We do that now. How do we connect those resources with those folks that are able and willing to take it? That is currently in development. Our goal is to build that and allow for the warm handoff for the vast percentage of our patients. I don't know how to measure that yet, because we're setting our structure and we're setting our measurements, because I wouldn't be able to tell you what those rates look like right this very second, but it's something that we're currently dialoguing. Those are some of the things that I think we're looking at, or I know we're looking at as some goals. But internally, the infrastructure, externally, the recognition for the work that we do, and ultimately the outcomes based on how we effectively minimize the need for receiving their mental health services in our facility. I would love for our folks to not have to come to me to be able to get their mental health services, their psychotropic meds, because they have a home outside. And I think the building up with Dr. Nutter and the behavioral health team of that robust network, county and everybody else, to be able to build that home base.
Thank you. Let me just throw this out.
Sure.
If they are being set up with Medicaid prior to discharge or soon thereafter, these are folks typically that have not had insurance before, so they don't really know how it operates. So my question is, if that is indeed the case, can we now connect them to FQHCs? And I'm going to name one in particular that has a pretty strong spike with psychiatrists, would be Aunt Martha's. I don't know if there's a right one per se, but the key is we have to do something, because you have the statistics of the people. I'm glad to hear that you know the ones that are coming back in. But if we do not, and they, I'm sorry, let me put in another plug. They have telepsychiatrists. So therefore, they can be connected to it prior to discharge, so that it's not so much of a warm handoff, it's a continuation. I'm just trying to get us to think outside the box and to utilize the resources that may be in existence currently so that we can stop the problem. And I'm pretty sure Aunt Martha's really could step to the plate on this, because they probably have the strongest network in at least in the Chicagoland area, if not the state. And this is not because of the chair, but this is just simply looking at the facts.
My staff are going to kill me, but thank you, Sam. We're always happy to help any way we can. So, and my COO would have that discussion, I wouldn't, but thank you, Sam. I appreciate the plug. Any other questions or comments?
Yes, I have a comment and an observation. My first job in public health, I was a community mental health worker in North Lawndale when I was 20 years old. And so I had a chance to work in the field for a little over 2.5 years. And I'm always struck by the fact that we talk about behavioral health and mental health as almost twins, but they're not. They're two different things. And we have an event coming up next week in this major conference. And I think it's an opportunity to take a deeper dive into this subject publicly and hear back from other people and get feedback, because it's a problem and it's not going to go away. Absolutely. But we need to understand that there are two levels. There are people that have behavioral health problems, there are people that have mental health problems, and many of them have both. And so we need to get a better idea of how to approach this moving.
Thank you for your work. I'm a little village kid. I grew up in a little village, so I'm right next to you.
Thank you, Manny. Appreciate always hosting you and your very important reports. Thank you.
Thank you. Thank you.
Let me just clean up one thing. I gave you the wrong date on the Behavioral Health Summit. It says September 8th. There's another big event going on with the county on September 8th. The Behavioral Health Summit is September 9th. So it's on the 9th, and I think it's on the website, so the information's easy to get to.
I'll be there. Look forward to joining you.
Thank you. Okay.
All
Go
right.
ahead, Dr. Makaitis.
Thank you, Chair Garza. All right, thanks, Manny. Thank you, directors, for the robust discussion. And Manny, thank you to you for the presentation and to your team for the incredibly great job that they do every day. It is now my pleasure to move to the third item on the reports, and it's an employee engagement survey results update from Marat Philippe, one of our colleagues at Press Ganey, and Ling Dang, our Chief Experience Officer.
Let me just open this up by saying that, you know, we sit in these meetings and we look at the results and the recognitions that we get, and Dr. Makaitis' CEO report, and there's certainly indication of tremendous progress being made, but to his thoughtfulness and his leadership's thoughtfulness, it doesn't end there, right? You want to know what the people that are directly responsible, the backs of the people that do the work, direct service work, are feeling about their experience. And I think this is a very transparent report, and I think you'll find that a lot of progress is being made, but that I don't think Dr. Makaitis would argue that there's more progress to be made, and that's his commitment. So with that, I'll turn it over to the experts.
Fantastic. Good morning and welcome.
Morning.
Morning.
Good morning. Lynn Dang, Chief Experience Officer. I do want to preface that the partnership with Press Ganey has been amazing. I've worked at many other hospitals, and I've never had such a strong partnership with them because of Murat's guidance in suggesting where we should gear and focus to improve the scores. We were actually very proud to share with you this PowerPoint, but then also the leadership of Dr. Makaitis, and then the support of all the C-suites in making sure that we had a good response rate, and just constantly being in the front of sharing what was going on, keeping the frontline staff abreast of all the things that's going on. The reason that we are here today is because it's a huge team collaboration, and I just wanted to make sure that everyone knows that I appreciate everyone's work. And so thank you, Murat. Go ahead.
No, thank you very much, Ling. Very, very well said, and a pleasure to be here. And as a almost over 50-year resident of Cook County, I can't tell you how much it fills my cup to have been at this meeting thus far and to hear about all of the good things that are happening at this organization. I've been with Press Ganey now Qualtrics for the last 25 years, and I am now appreciating all of the comments over the years about how small the font looks on these screens. So I brought my own a little bit closer here, but a pleasure to be with you today and share with you what we've learned as a result of the engagement survey. We do this always with the understanding that at the end of the day, and I've heard some of this language, I think, from you, Dr. Bott, that it is about delivering safe, high quality, and equitable care. That is exactly why we measure engagement, because we cannot do this consistently unless you have engagement, unless people feel good about safety, and unless this team is resilient to handle the very many ups and downs that happen in the healthcare industry, all across this care continuum, whether it is the work that Manny's doing, whether it is the work that's happening at County Care, whether it's the work that's happening at Stroger or at Providence. So that is why this work is valuable. On the next slide, we'll talk a little bit about a couple of surveys. So the first survey I want to talk to you about is the one we do for you we did last in January of 2026. This is the Agency for Healthcare Research Quality, the AHRQ survey, which is a safety culture assessment. We've done that survey for you. We've administered that federal survey for you the last 2 years. And what we've seen is that safety culture is getting better at Cook County Health overall. I think that is full stop. I think the really good sign to see. We see that the biggest gaps compared to the benchmarks that AHRQ keeps are around staffing and workload. That continues to be, I think, one of the bigger benchmark gaps that we see. And I think employees on the AHRQ are saying that there's an opportunity here for greater psychological safety, whether that is the hospital survey, whether it is the med office survey that we administer, or the ambulatory site survey that we administer for AHRQ. Continue to grow visibility of leadership, continue to grow openness to feedback, continue to grow how people are connected to the actions that take place after this feedback is provided. I think that's what we're learning from the AHRQ survey. On the next slide, we wanted to tie together all of these different surveys, the hospital, the ambulatory, and the med office, and we saw some common strengths across these survey types. A stronger willingness to report safety events is something we saw. Greater teamwork and collaboration is evident in the AHRQ survey results. Greater learning and improvement activities being visible to people. And also this recognition from leadership that patient safety is a priority. Not just patient safety, but also employee safety, but these are priorities for us. And so across all of these environments, what we're seeing is that many of the safety culture index results that we're seeing are getting better compared to the last survey we did for you in 2025. So that's the big takeaway here. Staffing and workload continue to be the things we want to keep an eye on, increasing psychological safety and my ability to raise my hand if I've got safety culture concerns, and not fear that the response is a punitive response. I think these are the things that elevate psychological safety going forward. On the next slide, I wanted to just tie together for you some of the things that we saw from your patient experience survey. We measure patient experience for you at Press Ganey across several service lines. And what I wanted to tie together is the fact that we don't need a separate plan for safety. We don't need a separate plan for patient experience that is separate or different from the plan that we are developing for employee engagement, because the connection points are real. What patients view as staff communicates clearly is very much the equivalent of how staff feels about communication from their leader and across departments. When staff feel that, when patients want to hear and make sure that staff is listening, on the employee side, it's psychological safety. So we might use different terms, but the plate is the same. Anything that you're doing to enhance patient experience, safety culture, and engagement, they help one another. This is the rising tide that lifts all of the boats in the harbor here. The next slide, I wanted to highlight for you that when we take a look at your patient experience drivers, what is it that makes someone want to recommend Cook County Health as a good place for care? It's not so much the clinical outcomes. Everyone wants a good clinical outcome. That's not going to determine whether someone recommends you or not. What does determine whether someone recommends you as a good place for care is how well staff communicate, how well they coordinate care, how well they demonstrate respect for the patient, and how much do they create confidence during that care experience. And I know that when we take a look at all of these different service lines, the themes about communication, about courtesy and respect, care coordination, and patient comfort are the themes that we're seeing, whether it's in the emergency department data, whether it's in the inpatient data, whether it's in the ambulatory setting, or whether it's the med practice. And so to that point, let's take maybe a pivot at this point and take a look at what we learned on subsequent surveys. Yeah. Oh, next slide, please. Next slide. So that was the January survey we conducted for you. Thank you, Debbie, for being my right hand. We also administered for you an employee engagement survey. And this is a survey we do for you every 2 years. I think I started working with you in 2018, and we did one in 20, 22, 24, and now the 2026 survey. We're looking at the data here for about 3,500 employees who took the time to share their opinions with us this year. That's a little over 50% of people that were invited, pretty much in line with where our percentage was of 57% participation last time around. And I am really happy to sit here today and tell you that when we answered these engagement questions, which as a reminder are 5 questions. Do you feel like you belong at Cook County Health? Would you recommend it as a good place to work? Are you satisfied working here? Would you stay if someone offered you a position elsewhere? And in 3 years' time, is this the place you want to be? Which is a real assessment of your belief in leadership, your belief in the strategy of this organization. So when answering these 5 questions, your mean score is anywhere from 1 to 5, and you can see in the circle here that we are 396. We're almost at a 4.0, which is an agree average. And this 4.0, or 3.96 to be exact, is a 14-point improvement in your engagement score from last time around in 2024. That green arrow here lets us know that that is a statistically significant difference when we're seeing 3,500 people move the mean score from a 3.82, which is where we were in 24, to now a 3.96. Something is different. People are feeling more positive, more willing to recommend, more willing to stay, more willing to feel like they belong at this organization. And I did see a hand. Yes, question?
Not a question,
Oh, sure.
observation, but it builds off of what you already said. That you can look at the data here, and we went from a 61% in terms of engaged and highly engaged to a 69%, which is an 8% improvement. So that's significant improvement. So I don't know what we did, but I'm looking at improvement, and I wanted to split that out.
That is 100% true. I think in the 8 years that we've been doing this, and I've got a chart a little bit later that'll show us that journey. This is the highest engagement percentile ranking. When we compare you to everyone else that we've surveyed across the country, and we do about 1.6 million employees in a 12-month period, your percentile rank in 2024, you were at the 21st percentile. So outperforming about 20% of organizations that we have surveyed the previous couple years. In this year's survey, you're now outperforming about 37% of these organizations. 37th percentile is the national database. That's about against approximately 350 organizations that we surveyed last year. And this is our highest ranking to date that we've had for Cook County Health. This is a real moment of celebration for sure.
Good.
And yeah, Dr. Question.
Yeah, I was just going to comment and build on what Dr. Harrington said. I think one, in my view, it's an enterprise priority and commitment. And that includes the work across the organization, the training, which, I think can contribute to this. And it's great to see the improvement. I think it's an opportunity to build on that and say, where are disproportionate areas of opportunity. to continue to build towards what I would say is great improvement. So thanks for all the hard work.
I'm sorry, can I add?
Of course,
to that?
of course.
So if we look at this, what it really says to us, we're making improvement, but we have areas that we can improve in, because if we put it on the ABC scale, it falls into the C+ category at best. So it's great to improve, but we have work we can do. And I think, Dr. Price, if we use my favorite person I love to pick on, she's not here, but over in the black belt category, we can definitely find those spaces with the Six Sigma to be able to find out where we can improve. Plus, I think this actually speaks loud volumes on the first pages where areas we can improve in, which I think with Wynn's help, we can do a lot of work here to be able to get that improvement that we're looking for.
Sure.
Yeah, one more thing that I want to lift up, and that's our employees again, because they do the work. And if it wasn't for the people that are doing the work and are here every day, these numbers would reflect something different. So it also indicates the level of quality of care, plus some of the ancillary things that happen around here that make these numbers what they are. So we want to applaud the people that are responsible for that.
Absolutely. And Director Robinson, I think one of the kind of approaches moving forward is exactly what you're alluding to. And I think, Murat, you kind of mentioned at the beginning is that, safety, employee engagement, and the patient's experience, all of those are inextricably linked, right? That those are all, if they don't feel safe, they're not going to be happy with their care, right? And if our employees aren't engaged, we're not going to have engaged and good experienced patients, right? So really trying to tie those things together and kind of bring that improvement mindset to that discussion. So yeah, absolutely.
Yeah, and I'm speaking specifically to non-clinical staff as opposed to the clinical staff, so it's both. Total experience.
Just a quick question about improvement. You mentioned people say I'm proud to work at Cook County. That's wonderful. There was 0.7 point improvement. I want to know that from where. Like, it might be that the majority of people feel proud working in Cook County, so it might not go farther up because we're already very high, or is it like from 10% to 10.07%? Like, what's your assessment? Where are we?
Of the sense of pride and the growth there that happened? Where is it exactly that improvement is happening?
What was the percent last time that you mentioned there's improvement, 0.07%?
On that question?
So.
Yeah, no, I think that pride question, we can certainly break it down. I don't think I have the specifics for each of the areas, but we did see significant improvement happening when we break the data down. I think on the next few slides, I have it by facility. We see several facilities, given their size and their response to, I would recommend, I'm proud, I feel like I belong. Well, that improvement happened for ACHN. It happened for the Bureau of Health. It happened for Stroger, which is obviously the most, the largest of the groups here. 1,800 people, I think, in that sample, significantly improved, and then also CERMAC Health Services. So it was happening across multiple facilities in the organization, and then across multiple positions as well. So if we look at the management, if we look at physicians, if we look at clerical staff, if we look at clinical professionals, and nursing CNAs, that's where we also saw significant improvement year to year. So it really is happening across a lot of different spaces, whether we look at it by facility, whether we look at it by various positions. And we can break it down even further, actually, as long as we have.
I think you have some nice visuals coming.
Yeah, coming for sure. That'll give us a little more insight there. Good. So if we can look at the next slide here, this one lets us take a look at the 5 engagement items that give us the overall score. And what I want to call your attention to are the arrows, the green arrows that are filled in and solid. That lets us know statistically. These are significant improvements at Cook County Health from 24 to 26. And that is on all 5 questions that are here. My intent to stay, my intent to be here in 3 years, my sense of belonging, my willingness to recommend this is a good place to work. All significantly better, and by not small amounts. We're looking at 19-point improvements, for example, on that sense of belonging. We're looking at 18-point improvements on my willingness to recommend this as a good place to work. And you're also looking at the distribution chart here in the middle that lets us see what percentage of answers across the 5 different options were in the top 2. Strongly agree and agree is the green. Sometimes it looks blue on screen. It's the green bar that you see here. The neutral 3 response is the yellow, and then the red represents the disagree and the strongly disagree answers, the unfavorable responses. So we're seeing, again, significant improvement across all 5 of these items. Our percentile ranks on these questions, ranking anywhere from outperforming 28% all the way up to outperforming the majority of the country, 53rd percentile on the top item here. I would like to be working here in 3 years' time. So is there still work to go? Yes, there is still improvement to be made, but there has been tremendous improvement from 24 to 26. We want to keep that momentum certainly going. Next slide. Takes a look at where we are when it comes to the well-being questions. We look at financial well-being, physical well-being, mental well-being. And when looking at that from this employee perspective, you can see that we're outperforming about 3/4 of the country collectively on these well-being questions. We're at the 76th percentile in the National Healthcare Database. You also see a safety net benchmark here. This is against 35 safety net hospitals that we surveyed in 2025. And you can see what percentage of those organizations you are outperforming. You're looking very strong in these spaces. Next slide, please. And I believe this is the slide that shows us the journey over the last 8 years. The blue line representing the Cook County Health Engagement Score. And you can see the dip that happened in 2022 after the effects of the pandemic. We can see the ripple effects of that there as engagement dropped to the 7th percentile. The pink line at the very top lets you know what the National Healthcare Database has looked like during that same time frame. And so at the very bottom, you get a sense of your percentile ranking versus just safety net hospitals. And as we see here, we started at the 9th percentile, so outperforming just about 9% of organizations. And this year, we are now at the 50th percentile in the safety net space. That is no small leap. That has been a journey. That is a very different Cook County Health than we saw back in 2018. Next slide, please. And if we take a look at the engagement results across the organization, the blue highlighted bar in the middle is the overall Cook County Health score for engagement. And again, we're looking at this by facility here, and I want to call your attention to the arrows on the far right-hand side. This is letting us see how these scores have changed year to year, and I want to call out there are 5 green solid arrows here. Those are the facilities that saw significant improvement from 2024 to 26, Bureau of Health, ambulatory and the Community Health Network. You can see that happening at Stroger Hospital as well as Cermak Health Services here. Next slide, please. And so as we start to slice the data, if we can maybe advance to the next slide, this will let us see how this data looks across different positions. And what I've highlighted here, the circles represent the scores for these different position groups at Cook County Health. When the circle is filled in, that is a significant difference. So red dots are significantly below their peers that work in similar positions across the country. Green dots represent groups that are significantly above their peer average across the country. And there's one group here with the arrow here that I want to call out, your nursing population. RNs, which make up about 704 people that responded this year out of the 3,500. That's the one group here that is significantly outperforming the RN average across the nation with that 4.02 score. So kudos to that nursing group and leadership team. I think that is outstanding to see. And what we see on the right-hand side are how these scores have changed compared to 2024. And the first thing that I'll note is that all of these bars are green. And that indicates that these scores are better across all of these positions than where they were in 2024. But the ones within the box with the darker green, these are significant statistical changes. So management engagement significantly improved. The nursing CNAs, nursing other group, significantly improved. Physicians, clinical professionals, and clerical staff kind of round out 5 groups that saw statistically significant improvement from last year to this year. Next slide, please. And if we take a look at this, the next few cuts just kind of look at this by shift. So we can see the day shift engagement tends to be below the day shift average. That's the one group that is significantly different from what we see for other day shift workers. But all of the other shifts, nights, evenings, flexible, they are within the ballpark of what the national average is for people working these other shifts. Next slide, please. And then if we look at this by tenure, we see that, again, compared to history, all of the historical scores got better. The darker green bars, again, indicate significant improvement happening for many of these tenure groups. I do want to call out that the 3 to 5 year range is the one group that is significantly above the average 3 to 5 year employee's engagement score. That is atypical, so kudos there, because most organizations see that 3 to 5 year range as the period where engagement is lowest. People have been here a few years, they're deciding whether this is the right fit or not, whether I should stay. So that is a really nice win to see. And then you can see that engagement tends to be a little bit lower for the employees that have been over 11 years. Over 11 years with the organization, that's where they are still below their peers, but that gap has gotten smaller. That gap is shrinking, which is good to see, you know, based on what we're seeing on the right-hand side. And then if we look at the next slide by sex, no significant difference between male and female engagement compared to the system average, which is good. The next slide after this looks at this by ethnicity, and we see here people that indicated they were non-Hispanic or Latino tended to be significantly more positive than the system average, with the solid green dot for that 4.02. People that preferred not to answer tended to be less favorable, which is what you see there on that slide. And then if we look at engagement on the next slide by race, we see no significant difference by the race of respondent, which is wonderful to see, certainly. And so as a part of the process, we identify some of the key drivers on the next slide, the areas that are the most correlated to engagement, and the order in which they're important. So the organization, Cook County Health, treats employees with respect. The best predictor of engagement is that single question. When people feel great about this, they want to stay. They feel like they belong. They want to recommend this as a good place to work. And what I'll highlight for you here is that we saw significant improvement of 15 points on that particular question from last year to this year. We want to keep that momentum going, because if we continue to improve that sense of respect that people are feeling from the organization, and what that means for people and understanding what that means, I know we're implementing always behaviors for the organization: being kind, being considerate, being connected, connected in the coordination of care, connected in our communication. All of these always behaviors that we're rolling out this fall and are really focusing on will help us to improve on confidence, building confidence in leadership, continuing to make sure that the actions of employees support mission and values. All of these drivers that we know that if we can focus on improving, will make engagement better in the future as well.
That indicator, all success flows from that, because when you have, especially in an institution like this, that is such a critical part of the community, and it's hard, grinding work at every level, from frontline workers to our people in administrative positions, because it's not easy running the largest safety net.
Yep.
If people feel like they're part of a team or engaged, everything else works, because that team aspect is critical. 100% critical here. You can have all the money in the world, which we don't, but because of the way our system structure, we do a really good job on working with what we have. And I will tell you that just organizationally, I don't feel like we're in a constant crisis circle, which has been the case in years past when these scores didn't look like this. That is probably the most significant thing, not just because I represent workers in my day job. This is it.
That's it.
This is it.
100%.
Yeah, and I think what I would add, because I know you have the most experience as a board member, Bob, what, 11 years now?
2017, so 9
years.
This is either my 9th or 10th budget, depending on what day I started. Debbie knows.
Yeah, we don't need to, I'm sorry. You still have the most experience as a point, but I would say it's also how this leadership handles crisis. I think that's different too. I know that when I've spoken with Dr. Makaitis, we've had check-ins monthly, his evaluation. He doesn't believe that culture is left by chance. Culture is intentional, and that's where his focus is. And I don't know, I don't know what you experienced before, but I've heard the stories, and I think that's a major difference. That there's intention around this.
It was administrative and cold.
Let that be reflected on the record, so I don't have to ask again.
Oh, no, not a problem. Not a problem at all. And I want to be respectful of your time. I know Yeah, via the
Which, by
next,
the way,
yeah.
that's nine presentations of this, right? Of
Yep,
surveys.
Yep, that's it. That's right. That's right. So I can open it up, certainly. I think the next few slides are pretty, unless there are questions, the next few slides are pretty self-evident, I think.
So let's
Highest
open
ranked
it up.
items, lowest ranked items. Any questions from the?
Questions, comments about what has been presented?
Just wanted to say that thank you and appreciate all the hard work on this. I think it's great to see. If you were to think about approaches that have helped drive this forward, one, I think Dr. Mercaitis talked about this interconnection between these different elements, of the organization and how people work. Are there other things that what we'd say are priorities to continue focusing on moving forward? And are there ways to have use cases? And I think the catch call outs that we do early are also tied to this. But I think more, I know that there are places that these stories come up in the day to day. So just curious about how we're telling the story, how employees are telling the story about their growth and impact, and how this is, making a difference for them, their teams, and then the organization.
Great ask. I would say the biggest things are, and you're doing them, right? The always behaviors, the kindness, the coordinated care, the consideration and being considerate of people. All of these tie together, and I would say we have to have those behaviors. We have to identify who in the organization is doing it well, and what can we learn from those people who are doing it well, because it's obviously working in many spots. And now the next challenge becomes, how do we make that more consistent? Or how do we make that more reliable, so that not just, let's say 60%, 70%, 80% of people are doing these behaviors, not just, for some patients, some of the time, and some of the behaviors, but they're doing it 95, 98% of the time. It's consistency at the end of the day that helps organizations go from a good score to a great score. And I think that high reliability practice is kind of, what we would recommend. And obviously anything that you can do on the, respect piece, and making sure that employees feel that their actions are tied to mission and connecting people to mission, because time and time again, the mission here is what brings people here. That's what keeps people here. So as long as your actions and behaviors are transparent, you're involving and having dialogue with your staff, and educating and training your leaders and bringing them up so that there's less human variability, perhaps, from leader to leader. These are the things that ultimately high-performing organizations are able to achieve.
Thank you.
Of course.
Given your experience here, do you have any best practices that would allow us to achieve those objectives?
Yes, for any of the key core items, we do have some best practice solutions that we offer the organization, so that when you're developing plans, and I think we talked a little bit yesterday as we rolled out a retreat that talked about patient experience and employee engagement, and how if you work towards the same common purpose, here are some best practices. And again, it will be tied to some of the always behaviors. And I think Ling, if you wanted to, okay. There are some best practice behaviors certainly that, we're trying to say, don't develop plans that are separate from each other, but if you can do a plan that helps you with respect to connection, with respect to understanding and being considerate of each other, these are the best practice behaviors that, we make available to any of the managers in our system.
So Murat mentioned the retreat, very briefly. So that happened yesterday. That was our entire leadership team came together, and Dan went through this deck, but then also, we called out our county care team. They're the leaders in the organization as a division. I think the 4.19, I had that backwards yesterday. But having met with them from the drop of the report to the retreat yesterday, I had the opportunity to talk to Aaron and Christy Torino about what they've been doing, and there's a lot of intentionality there behind kind of how they're engaging with their team. So they were kind enough to come and give kind of a, here are the things that we're doing. So that was kind of a springboard into the work sessions later in the afternoon with the rest of the leadership team. And there's within the platform what Murat's referring to, kind of the standard operating, standard plays in terms of how you engage at the front lines. But then there's also space to kind of build your own specific, you know, interactions or interventions that you're going to do to try to drive the culture forward within department level. So as we build out kind of this cascade from senior leadership to managers to the front line, that's going to be a tool that we start using to really kind of pull the thread through the entire organization. As you know, looking forward into the next 2 years, I can say looking back, a lot of work around leadership presence. We've implemented, you know, bi-weekly leader rounding. We have started a lot on communications, quarterly town halls, office hours, those types of things for staff to just come and sit and chat and kind of, you know, share what's on their mind and hear about updates about what's going on in the organization. So I think a lot of those types of things have helped. We've really consolidated, thanks to Alex's help, a weekly communication that our managers can now use to, like, in their huddles, basically the need to know. We used to push out very dense information to the organization that really, you know, it was kind of hard to get through a little bit. This was a one pager, kind of 8 to 10 bullets. Managers can use it in their huddles every morning and engage the teams on here's really the core things that, you know, you really need to know about what's going on at Cook County Health. So that's looking back. Looking forward is a lot of the things that we've talked about, consolidating all of that work, using the tool to really pull that thread through and make sure that we're, you know, from myself all the way out to the front lines, that we are kind of making sure that all of that's happening with that consolidated mindset of all of these things are inextricable, and we need to ensure that patients are having a good experience and our employees feel supported and engaged, right? And that there's a safe culture around all of that.
So that's the type of granular information that I'm looking for. But my ask from him was, because we're looking at divisions, if Aaron, and they're doing a great job over there, we surely can pull some of that information. But if he can look at other divisions that organizations that are really doing well, then that may help reduce the learning curve so that we can look at those and say which ideas may work better here.
Yeah.
So that's
Yeah,
my
in
question.
terms of nationally, yes, we can network and help you network with other organizations that are in the same space that are doing particularly strong work and you know, learn from each other. So
and Murat, I
sure,
think that's kind of what's baked into the platform, or kind of here are the things we know work everywhere.
Right.
Kind of,
So there's some things that are baked in, but yes, if there are additional opportunities to, you know, have one-on-one conversations with other systems or other hospitals, we can certainly, you know,
and I
facilitate
think
that.
the nice thing about the platform too is that we can drill into the manager level and see kind of, okay, is this tracking with the zoomed out kind of entire system data, or are there different opportunities at the manager level? And that's that piece of pulling the thread all the way through the organization. So we're not working on respect if that's not the issue, if it's a different problem at the unit level, that we're addressing that specifically. Okay.
I also want to do a brag for Aaron Gleaner's team. Their PowerPoint and what they're doing was so amazing that Press Ganey's team asked if they could have a copy of that PowerPoint to share with the nation because of what they're doing.
And this is now a 5-star HCAHPS rated part of the organization, which is pretty impressive for sure. So we're seeing stronger engagement, stronger perceptions from the patients as well. So that connection, you know, very, very great case study of that here.
So you're sharing what we're doing nationally with others is a best practice.
Right.
Congratulations, Aaron. Well, Murat, we're certainly fortunate to have you. 25 years at Press Ganey. It sounds like you grew up there.
I did.
Yeah.
I shaved the gray.
I understand. Yeah. I think we need to move on because we've got one more presentation. Thank you, everybody. Appreciate your time and the work you're doing. Thank you. Okay, we have one last item on the agenda, but certainly an important item, and that is a quarterly report on the Cook County Department of Public Health, presented by Dr. Yoshi.
Thanks so much, Chair Garza.
Chief Operating Officer. Let me get your title.
Apologies. Yes. Thanks so much, Chair Garza. Good afternoon. Good morning. Good morning, directors. So good to be with you, Kieran Joshi, Chief Operating Officer, Cook County Department of Public Health. I can tell time. Here with Amy O'Rourke, Director of Chronic Disease Prevention, and Frankie Shipman-Amuo, Senior Director for Community Health. I always like to begin our presentations with some grounding in the work that we do. I've had different versions of this one slide before, but my hope is that this will not my hope, this slide will be repeated, and my hope is that it will help communicate what we do in a succinct fashion. So who are we? We protect health, we prevent disease, We inform the public and engage communities, and we analyze and share data for action. So those are the 4 big buckets of work that we do at CCDPH, and you'll be hearing from Amy about specifically our disease prevention work, keeping in mind and acknowledging that all of this is interwoven, because Amy couldn't do her work without the strong data that our epidemiology team produces, and couldn't do her work effectively without engaging with communities. And of course, we always work to get the message across, as per some of the conversation earlier. So informing the public also very critical. So that said, I'm going to stop talking and get out of Amy's way.
Great, thank you so much. I'm so happy to be here with you today to talk about the work that we're doing to advance health equity, really focusing on upstream solutions or approaches. So today I'm going to spotlight just a few of the initiatives we're leading, the partnerships that are in place that make this work happen, and the impact of this work. So I'm excited, and also the impact of the work, the investments that we're making in the West and South region of Cook County as well. Next slide, please. So as Dr. Joshi mentioned, our work is really focused on advancing health equity. So before we jump into the work and the ways in which we're approaching addressing these challenges, I wanted to first ground us in the challenges we're facing, the public health challenges. The challenges you're all familiar with. Chronic diseases remain a leading cause of illness, disability, and death in the U.S., resulting in premature death in Cook County. But that burden is not shared equally. Black residents and communities facing long-standing inequities experience disproportionately poor health outcomes. And these disparities, as you know, and as we've discussed today, are shaped by community conditions, including access to healthy food, safe transportation, access to healthcare, economic opportunities. Increased food insecurity caused by recent SNAP cuts and rising household costs are placing additional pressures on our residents. And by addressing the root causes of chronic disease, we can reduce preventable disease and death, advance health equity, but sustained public health investment is critical in this work. Next slide, please. So as Dr. Joshi alluded to, the work that I'm going to talk about today is about preventing chronic disease. And the way that our team approaches this work is really focused on partnering with community and county partners to strengthen and support policy systems and environmental change or approaches that promote healthy eating, active living, and tobacco-free communities. Next slide, please. You'll recall about last month or a few months ago, this board did review our Building Healthier Communities 2030 plan, our Community Health Improvement Plan for suburban Cook County. This plan was designed in partnership with community to identify the key health priorities within our region. And we've worked and engaged to develop strategies, goals, and these priorities. The priorities of this plan are chronic disease, behavioral health, and maternal child health. This plan was recently approved by the Illinois Department of Public Health earlier this month, and we will be hosting a press event next week, officially launching the BHC 2030, so we hope to see many of you there. Next slide, please. So as I mentioned, chronic disease was identified as a key priority within BHC 2030, and much of our department's work is reflected within this critical plan. We work closely with community partners to develop the chronic disease goals that are before you and these key strategies. The first goal is focused on improving access to healthcare and preventive care in historically marginalized communities. The second goal is focused on the built environment, including improving opportunities for safe physical activity, improving access to stable and healthy housing, and also building climate resiliency within our communities. And finally, the last goal is focused on improving access to healthy food and nutrition resources. Over the next few slides, I'm going to walk us through a few examples of the work that we're leading across these different goal areas. Next slide, please. Goal 1, improve access to healthcare and preventive care. A key strategy identified by partners, including Cook County Health, was focused on preserving and protecting Medicaid and other health insurance eligibility. CCDPH is actively participating in several multi-sector coalitions, including Cook County Health's Medicaid Impact Working Group, to lessen the impact and to develop coordinated strategies to support our residents. CCDPH recently partnered with Cook County Health and County Care to convene faith-based leaders in the West and South region of Cook County to disseminate this critical Medicaid information. And quick shout out to my colleague who's not here today, but this was led by the Community Engagement and Health Education team, Alicia Boyd. And we continue to find opportunities to disseminate these key messages about Medicaid changes and how individuals can maintain and access this benefit through the Medicaid Get the Facts campaign. Next slide, please. Another key area that I wanted to highlight is our work around launching our new youth-focused anti-vaping campaign called Ditch the Cloud. This was released only a few months ago and will run through the remainder of this fiscal year into next year as well. This Ditch the Cloud campaign was designed to raise awareness about the health risks of vaping and help young people make informed decisions about nicotine use. This new campaign is a collaboration between our tobacco prevention team led by Mila Sepulveda and Ryan, and our comms team led by Everett Stein. This campaign was supported by funding we received from the Illinois Tobacco Free Communities Grant. We're really proud of this work because this work is really an opportunity to meet youth where they are. We had an opportunity to engage and conduct conversations with suburban Cook County youth to inform the development of this campaign. And what we heard from them, their perceptions, their insights are reflected in this campaign. Many of the young people that we spoke with told us that they would like to receive anti-vaping or vaping prevention information and cessation resources at schools. So as a result of that insight, we've designed our campaign to really focus on engaging schools. A variety of school-based materials, including posters, have been sent to all suburban Cook County high schools and suburban Cook County community colleges. We are also engaging schools, school health staff in a variety of presentations to make sure they're using these resources and providing those cessation resources for students that they need and are asking for. The campaign also includes bus shelters strategically located near schools and community colleges, and social and digital advertising. We also recently released, and it's linked in the slide deck here, a new peer-to-peer video featuring local high school students sharing honest perspectives of vaping, addiction, and making informed choices. We continue to partner with Respiratory Health Association, one of our critical partners in this work, to facilitate student-focused vaping prevention presentations at suburban Cook County high schools, last year reaching thousands of students with this material. Yeah.
I'm assuming you have, because it's hard to understand this without some idea of how many kids are vaping and what. So you don't have to present it now, but it helped to know to what extent, what are we talking about, where the population is.
That's a really great question. So just to address that, while e-cigarette use among youth has declined in recent years, vaping remains an ongoing public health threat, especially because of widespread misinformation and the new and evolving products that are constantly being introduced to our market, especially with the complexity of the FDA approving products, flavored products recently. In our 2024 Suburban Cook County Youth Risk Behavior Survey, we found about 8.5% of Cook County students in 9th grade through 12th grade reported current e-cigarette use, down from 16% in 2022. So we're on our way, but it's still not zero. And of those, use was significantly higher in 12th grade students, though, with about 14% reporting current use. So we're headed in the right direction, but because of the complexity and the misinformation, we're seeing backsliding as well, and we want to prevent that as well.
I just wanted to point out to the board that the Youth Risk Behavior Survey is something that is funded by the CCDPH budget. It's a survey of high school students that we conduct biannually, so once every 2 years. And as per Amy's comments, is one of the ways that we use data to inform our strategies. There are many other examples of this, but given the opportunity, I thought I'd share and sort of make that connection. Thanks.
Great, thank you.
Not every health department has the resources to do that kind of thing. So we're very appreciative of that support.
And I do want to acknowledge, I did include some additional information about the campaign and what we've learned from the conversations we had with youth 12 to 24 or young people 12 to 24 in the appendix as well. I also included a slide on some of the tobacco inspections that we conduct as well and the results of those, but we won't talk about it.
I'm just curious, what was the number one reason for why 12 to 24, why they vape? I'm just curious.
The number one reason why?
Yeah.
Oh, so that's something I can circle back and provide more information on, but for a variety of reasons. Unfortunately, and what we found in the conversations is many youth and young people don't feel like they understand the more immediate consequences. They see some of the consequences as being farther out. Someday I may develop cancer, but right now, this campaign's really focused on the right now impacts, the brain fog, the mental health concerns with vaping, the increase in anxiety, and addiction. What nicotine does to the youth and young person's brain is really troubling, and that's what we heard from the young people we need to talk about, not fear, but facts about what happens to them now.
So again, I would just add, this is another way in which we're drawing from the data and data that is both quantitative, the survey data, as well as qualitative conversations or focus groups with youth to drive our strategy. And I'd be remiss if I didn't also acknowledge the support of the CCH communications team and Alex Normington in working with us to develop some of these campaigns.
Do you also use their methodology to be able to do the reels or whatever to impact it?
Yeah, so this year we had a part of our social media promotion as well. We're on Twitch. So that's an online gaming platform as well. So we're finding new and different ways of meeting students, not only in the schools, but where they are outside of schools as well. So different ways of engaging youth. And so in future reports that we present to you all, we'll provide you more of the analytics of the impact of the campaign. But so far, anecdotally, in the camp with the printed materials and going out into community, it's been very favorably received. People are loving this new campaign and the approach and the messages we're sharing.
I mean, I would say Twitch is very innovative. I wasn't thinking about that. You're saying that you're using data to guide your interventions. That's amazing. So I'm just curious. I would say, like, even before you talk to youth, going into school is like, it's not, you don't need data, right? So I'm just curious, like, different ways to approach this youth vaping. How much data do you have, and are you beginning to look at the data? Which approach is more effective?
Yeah, so I will say that this is just one of the strategies that we're funded to support. So our tobacco prevention and prevention and control efforts are a multi-pronged approach. One approach, one strategy that is known to be effective is communication campaigns, but that's paired with our other work in policy change. So we're actively working with local communities to explore ways to advance reductions or to restrict the sale of flavored tobacco products, something that the county board approved for unincorporated Cook County specifically for liquid flavored nicotine. So we're trying to find ways strategically partnering with our advocacy partners as well as communities around suburban county to advance those types of restrictions, policy change, to restrict access to these dangerous product.
I mean, that's what I'm saying. If you have that sort of like policy level, like banning, selling of those, you may not need to like actually go into school trying
Sure.
Yeah,
unfortunately, that policy change is hard because the tobacco industry and its advocates are very strong. So, and again, this is a difficult political environment. Many communities are struggling. Municipalities, businesses are struggling as well. So there's a lot of, unfortunately, there's not the warm, open arms. But that is where these types of campaigns help to influence that type of change, bringing the level of awareness to elected officials, caregivers, adults, decision makers, as well as youth about the risk and the importance of removing access to these products. So it's that multi-pronged approach that we're taking to advance this work and to make the real change happen.
Yeah, I'm going to ask the board to allow the presenters to work through this so that we can wrap in the next 10 minutes because we're over. If that's okay.
Sure,
Thank you.
yes.
Message received.
Got it.
No.
Talk less. As you can see, I'm very passionate about this work. So goal two, thank you so much. Improving access to infrastructure. So I'm really excited about the work that we're doing right now with the Cook County Department of Transportation and Highway and the the Active Transportation Alliance. And what we're doing is really focusing on investing in safer transportation infrastructure, which is needed because it protects vulnerable road users, bikers and walkers in communities, while supporting everyday physical activity in healthier communities. So what we're doing right now through this project that we've funded is we're providing tailored one-on-one guidance to about 14 suburban Cook County communities through something we're calling this Illinois Transportation Enhancement Program Learning Collaborative. This the Illinois Transportation Enhancement Program, or ITEP, is Illinois' largest active transportation funding source. So we're working, but it's extremely competitive. What we're doing is we're working with communities that have been historically disinvested in and bringing added capacity, expertise to the communities as they develop and shape their transportation projects and their applications. We're bringing them, addressing their questions with IDOT, for instance, so we can make their applications as competitive as possible. What we're also doing is we recently hosted a countywide ITEP webinar for Cook County communities. Many elected officials attended, community municipal staff attended, and we had speakers from Cook County Department of Public Health talking about our health atlas and the data available, as well as Cook County Department of Transportation and Highway and the Bureau of Economic Development, highlighting the variety of county resources available to support communities with these resources. The applications for ITEP are due in October, and we hope to hear from the communities the results of their application early next year. But regardless of the state of that application, we're looking to connect them to the resources they need, whether it's Invest in Cook that can be leveraged, transportation dollars that are offered through the Department of Transportation, or through the Community Block Grant Development Funds available through BED. So we're bringing all these partners together to really support and give these communities the resources they need to be able to access these dollars to make environmental changes happen in their communities. Next slide, please. And then I'm going to end on the work that we're doing in the food space. There's much more work, but this is just a snapshot. So one of the key strategies we're working to advance is protect and preserve the participation in food access programs like the Supplemental Nutrition Assistance Program, or SNAP. CCDPH is serving as something called an anchor partner in the Community Benefits Hub that was recently established by the Greater Chicago Food Depository. Other anchor partners include the Office of the President, Cook County Bureau of Economic Development, the City of Chicago, Chicago Department of Public Health, and many other community orgs involved in enrollment and referral. What we're doing through this Benefits Hub is to improve access to these resources by coordinating enrollment, standardizing training, and outreach with an immediate focus on addressing the SNAP benefit changes that are happening and impacting our communities today. We're working to ensure that residents maintain their benefits and or regain their benefits if they've lost them due to the new work requirements. Unfortunately, about 150,000 Illinois residents recently lost their benefits, and again, community partners are working to regain and gain access to those benefits again. We're also actively participating in a statewide coalition called the Save Our SNAP program, or excuse me, Save Our SNAP Coalition. And this is a group of community orgs united to strengthen SNAP in Illinois. A recent victory, the results of our Save Our SNAP advocacy, statewide advocacy, was something called the FRESH program, which was created to support individuals who lost SNAP by providing a one-time $400 payment to individuals that lost benefits due to the new work requirement. So again, we're proud of the success, but this is only putting a Band-Aid on a major issue. And we're working strategically with partners across the county, the city, and the state to work to minimize the impact and the harm to our communities. Next slide. And then I'm going to close out on the work that we're leading called the Good Food Purchasing Program. This is our work to expand access to local, healthy, sustainable, just, and humane food that's procured, served, and sold at county departments, including Cook County Health. And this is the result of something called the Good Food Purchasing Resolution that Cook County Board of Commissioners approved in 2018. This resolution expects all county departments that procure, serve, and sell food to participate in the program and really focus on investing in local, healthy, sustainable, just, humane food in our communities. Like I said, we're working actively with Cook County Health, the Juvenile Temporary Detention Center, and Cook County Jail. Cook County was a national leader. We were only the third local government to promote GFPP. And now we're joined by many, including Boston, New York, that are also demanding good food. Since 2018, Cook County Department of Public Health has been working with and leading this work in partnership with Chicago Food Policy Action Council. We also convene a quarterly Good Food Task Force with a variety of Cook County departments that I've already named, as well as community food system stakeholders. Recently, we've been leveraging some ARPA funding that we've received from Cook County to accelerate this work. With this funding, we've provided more tailored support for GFPP implementation at the county departments, purchased new kitchen equipment to support more fresh and healthy food production at these county-run institutions, and began to implement strategies to prevent food waste, specifically in CCH cafeterias. I have more information about GFPP in the appendix, but we can move to the next slide. So I just want to spotlight CCH really fast. We've been working, and we really appreciate CCH's ongoing leadership in advancing good food purchasing, specifically Donica Austin-Caffey, who's been a great leader and proponent for this work, and Alicia Taylor as well, who oversees the food service department. Cook County Health is setting a national example of how public institutions can leverage food procurement to improve access to healthy, local, and sustainable food. In 2026, shout out to the CCH team, CCH and Morrison Healthcare was designated with the Good Food Bronze Leader Award by the Center for Good Food Purchasing for their commitment to this work. We're working with CCH and Morrison to prepare and serve more healthy food from local food producers, and we're finding ways to integrate our good food goals into their future food service contracts. To further support these goals, like I said, we've recently purchased new equipment for the Stroger cafeteria to support more on-site fresh food preparation. And we also recently, late last year, participated in and conducted a Cook County Health food waste audit at Cook County Stroger and Provident Hospital to identify ways that we can implement new strategies to prevent food waste and explore opportunities to recover and donate food from Stroger and Provident. So we're excited for those opportunities to continue to expand. More information about that food waste results, the audit results, are found in the appendix as well. Next slide. And just to kind of build on the conversation that Manny shared about the work underway at the Juvenile Temporary Detention Center and Cook County Sheriff's Office, at the heart of good food purchasing is equity and the belief that everyone deserves access to good food, especially those that are in county institutions. We work closely with the Cook County Juvenile Temporary Detention Center and the Sheriff's Office and the County Jail to implement GFPP in their kitchens and increase healthy food access for justice-involved youth and adults, as well as their staff. We've been working with these groups since 2018, and I'm really proud of the progress we're making leveraging these ARPA dollars. What we've been able to do over the last couple of years is bring in tailored support to provide hands-on scratch cooking training in these kitchens, specifically Juvenile Temporary Detention Center. We did a scratch cooking assessment in 2025 and found that about 7% of the food served at JTDC was scratch prepared or minimally processed. Most of the food being served was processed food, heat and serve. What we've been working with them on is redesigning their menu to offer more fresh local food, find ways in their contracts to purchase more local food, and they're making progress of producing about 40% scratch cooked food by before the end of this year. We just did an assessment of their menu and they were at 38.5%. So this is the result of leadership, of kitchen leadership, of juvenile temporary detention, really believing in this work and the impact that this has on those that are in their care, youth involved, justice involved youth. that are in their care. With this, we're also, I'm proud to share, again, we've provided on-site training, but that's coupled with on-site or the purchase of needed kitchen equipment to really make these changes sustainable within the kitchen. I'm also excited and proud to share that JTDC and CCSO also recently received the Good Food Bronze Leader Award. So again, Cook County is showing up and advancing GFPP as a result of strong leadership and commitment that good food is a right for all. Next slide, and this is my final slide. We're increasing investments in local food producers because we recognize that building an equitable supply chain is essential to advancing good food purchasing. So what we're doing is since 2023, we've awarded more than $1.5 million in funding from ARPA awards that we've received to 14 suburban Cook County food producers and businesses in the Southland and West Cook County in partnership with the Chicago Food Policy Action Council. Again, what we're trying to do is increase investments in local food producers and businesses, especially Black and Brown producers in our region. These food producers and businesses are increasing access to local and healthy food, with nearly all partnered with community meal sites like schools and local food pantries. It's important to note that GFPI Community Fund goes beyond funding by fostering collaboration and capacity building among awardees. I'm really excited to share with you that there's an emerging network of South suburban farmers and food businesses that are now collaborating as a result of this funding, of this network, bringing these farmers together, food businesses together. They're going to be shifting in 2027 to a group that is co-convened or co-led by community and CISPAC to continue to expand and strengthen the local food economy and improve access to hyper-local food in the Southland. More information about this fund can be, and including the list of those that we've funded, can be found in the appendix. Finally, an additional $200,000 in Cook County funds or Cook County Community Fund grants will be awarded to suburban Cook County food producers later this month or next month, early next month, leveraging our ARPA funding. So more information to come. And then it's the last slide, I promise. Next.
It is, Amy. Yes.
Yeah.
Let me just say this, because we've got to wrap.
Yeah.
First of all, you're the right person to be leading this. Your passion comes through. It's amazing how you've put these different relationships together. I can't say enough about how I think people like, I remember Dennis Steer, former Commissioner Dennis Steer, late Commissioner Dennis Steer. This is a big deal for him. I mean, he was on this stuff years ago, and I'm sure he would be smiling where he's at today, as we all are, at the work you're doing to help people in the community where they've lost these key benefits. So I know the board will review this. If there's any follow-up, we will follow up with you. Thank you for all that you do,
Great.
Amy.
Thank you.
It's really felt, and no doubt appreciate it. Really means a lot. Dr. Joshi, thank you.
Thank you
so much. Appreciate it.
Thank you.
Okay, you're halfway through the agenda.
Motion to adjourn.
Yes, of course I just, but really, I can take 1 minute just to say, what a great way to start the weekend. And a new season is upon us, fall. Yeah, the fall. But no, to the staff that are here, just know that we honor your work. And I say that with complete sincerity, and it's rare that I speak on behalf of the board, but I know each board member, and I know they feel the same way. And it's meaningful work that you're doing for the community, and we feel it, we see it in the community, and we feel it at the board meeting. So thank you for all that you do, and have a rested and enjoyable weekend. Thank you. The meeting is adjourned.